what we want to talk about is what the aftermath may look like and what some of the pitfalls can be. We're going to touch on this briefly, when we're cleaning up, some of those pitfalls.
Sure. So, I mean, again, pitfalls are not to overextend your boundaries of your physical ability so that you don't get into situations where you may injure yourself. The common one with the down power lines and the standing water. Also, I think a common one is returning when there's an evacuation zone, not until you're allowed to return. We always want to sort of go back and see, and the cabin fever and the curiosity always wants to get the best of us. But being cautious about your return to your situation and trying to sort of force yourself to return to normal. Things are not going to be normal for a while,
right.
And you have to be careful there. It's sort of adapting to the scenario. Rely on what is most essential. You're alive, okay, you're safe, no major injury. Let's try to keep it that way. If you have water supply, that's obviously most important. If there's some food supply, obviously that's most important. And medications, and if your medications are there, then right. Those are the most important things. Communication is also very important. Nowadays, obviously, we communicate very differently. We still have a landline, for whatever reason.
That's
I'm
okay,
sorry
I do
that's
too.
not
That's all right, I do too.
But part of the reason why we still do have a landline is because of that. It's
yes.
always easier to just, sometimes if the phone lines are still working, you can
sure.
plug in your landline and still use your landline versus the cell phone tower that got destroyed. So always thinking a little bit ahead of time, again, is always very important, and really being mindful of your condition and your clinical conditions. So that's also very important. If you suffer from any chronic medical condition, or like I tell patients, if there's anything that you're using that you plug in to care for yourself, whether it's a nebulizer machine, or it's an oxygen supply system, or if you have any dialysis, home dialysis
right.
type of things that you need electricity for, those things are very, very important, and you have to think of those things ahead of time. A very, very small investment, which for something simple, one of those smaller generators, specifically for your medical needs, may be a good idea. If you have refrigerated medication, that's also very important.